Darkness blanketed a nation. A pandemic gripped the globe. For the past year, we've watched as the coronavirus took from us our loved ones, many dying all alone.
I want you to know that my faith has never wavered.
500,000 deaths and counting. 1 year after the Arklatex discovered its first COVID-positive patient.
We can now confirm that there are 13 presumptive positive cases of COVID-19 in Louisiana.
That number now well over 430,000 in the state. As the virus began to spread, scientists raced against the clock to come up with a vaccine.
This is huge.
A new option emerged in the fight against COVID-19. The U.S. now has 3 vaccinations available.
It's the only way we're going to get past this pandemic.
Tonight, a light at the end of the tunnel. We address the truth and myths about the coronavirus vaccine.
Racial disparity when it comes to getting the shot.
And finding trust in the process.
Our KSLA News 12 special, COVID Cold Feet, the truth about vaccines.
From KSLA News 12, your vaccine questions answered. This is COVID Cold Feet.
And good evening. Thanks for joining us for KSLA News 12's hour-long special, COVID Cold Feet, the truth about vaccines. I'm Adria Goins.
And I'm Dominique Ben. Over the course of the next hour, we closely examine your COVID-19 vaccine options with some of the area nation's top health experts.
Today marks the 1-year anniversary of the first COVID-19 case in the state of Louisiana. This week marks the 1-year anniversary of the first reported case in Caddo Parish. Hours later, Louisiana Governor John Bel Edwards shut down schools statewide. It wasn't until December when the Arklatex saw the first vaccines roll into hospitals and vaccination sites. First responders and hospital staff were the first to receive a dose.
According to the Centers for Disease Control, more than 82 million doses of the coronavirus vaccine have been administered so far in the United States. Pfizer is one of 3 vaccines approved for emergency use authorization. The development of the vaccine has a direct connection to LSU Health Sciences Center right here in Shreveport.
And the big regional COVID headline for today, Louisiana expanded who's eligible to receive the vaccine. Earlier today, Governor Edwards expanded the eligibility to include teens and adults ages 16 to 64. If you are in that age group and have a pre-existing health condition, you can now sign up for the vaccine.
And many of you still have questions about the vaccine, and that's why we are here tonight. We're allowing you to make an informed decision about the COVID vaccine.
We are joined by a panel of experts who've been instrumental in the fight against COVID-19. Dr. John Vancherry, director of LSU Health Shreveport's COVID-19 strike testing and vaccine team. He was also the principal investigator for the area's Pfizer vaccine. And also Dr. Chantel Hebert-McGee. She is the Louisiana Department of Health Regional Medical Director for Region 1, which is in South Louisiana. Thank you guys so much for being here.
And we want to thank them, of course, for being here tonight. We've asked our viewers to submit questions they'd like to ask concerning the vaccine tonight, and we'll get to those throughout the next hour.
But first, we do want to start with the vaccines. Of the 3 vaccines, Pfizer, Moderna, Johnson & Johnson, we ask you, Dr. Vancherry, is there one that is better?
So I think when you're considering the 3 vaccines, they each have advantages, and so I don't put any one of them better than the others because of just the logistics of delivery and the like. So if we talk about the Pfizer and Moderna vaccines, those are very similar. Those are mRNA vaccines, but they require 2 doses, and they require a little colder temperature to maintain those and keep them viable as a vaccine. The Johnson & Johnson vaccine is not quite as effective, but it's very close, and it has fewer side effects, and it also only requires 1 dose. So when you balance those pluses and minuses out, from my
So, Dr. Hebert-McGee, we want to ask you as well, do you consider, once you take this vaccine, do you still need to wear a mask? A lot of people have that question once they get vaccinated. Do I still need to wear a mask?
So wearing the mask not only protects you, but it protects others, right? So the whole goal is that we recognize there are many people who are not vaccinated yet. Additionally, if you're going to go around family members who may be prone to a more severe illness if they were to contract the virus, we want to ensure that that doesn't happen. So we encourage people to continue wearing the mask, not necessarily in closed household spaces around family. It's free not to wear the mask. But if you're going to go around individuals who would have severe disease if they were not vaccinated, or if you're going to be traveling, we encourage you to also wear the mask in that location, in that occasion.
What about I guess the CDC's new guidelines? They've relaxed them a bit as far as who you can be around if you've been fully vaccinated, being around other people that are fully vaccinated without a mask, or possibly in one household with people that have not been vaccinated.
Right. So as I mentioned, that if you're going to be around your household family members and they're not at risk for severe disease, you can feel free not to wear a mask. And of course, if you're around individuals who have been completely vaccinated, meaning that they are 14 days past their last vaccination. So if it's 2 doses, if you're getting Pfizer or Moderna, or it's 1 dose if you're going to, if you've been the recipient of J&J. So 14 days after receiving your last vaccination, you are believed to be fully immunized. So therefore, if you're around other individuals who are fully immunized, you don't have to wear the mask. And that is a return to normalcy. And I think people would appreciate that.
All right, Dr. John Vancheri, you know, we get a lot of questions and comments in our inboxes saying that this vaccine was just developed too fast.
Well, I guess that depends on your perspective. We're in the middle of a pandemic and a lot of things move fast. So I think it's important to note that the vaccines, both types that we're using, the adenovirus vaccine of Johnson & Johnson, as well as the mRNA vaccines, those types of vaccines have been in development for decades and used in different circumstances. The adenovirus vaccines are used in Ebola vaccines and other vaccines for diseases that we don't have here in the United States. And the mRNA vaccines have been under development as anti-cancer vaccines and for other infectious diseases for a long time. So we know a lot about these vaccines. None of these types have ever been approved for general use in the United States, but their development, really the rapidity of their development in less than a year is because we knew already a lot about these vaccine types, and we had a lot of background research to give us the assurance that this was a good route to go.
What about the vaccine makeup? You spoke earlier offline with us earlier this week about Pfizer and Moderna having the spike protein and how different that is from Johnson & Johnson, which uses the common cold, but not yet the live virus. Can you explain the difference between those in the buildup?
Sure. Yeah, so all of these vaccines have one goal, which is to educate our immune system, our infection fighting cells, about the spike protein of the coronavirus, because that's the protein that coats the surface of the virus, and it's what our immune response is directed against most strongly. And so the difference between these is that the Pfizer and Moderna vaccines are an mRNA vaccine. mRNA is a recipe to make a protein. And so we deliver that recipe into our cells, and our cells make the protein, just like baking a cake, follow the recipe. And that protein gets decorated with sugars, in fact, in our cells, just like a cake would. And
it can go out to many more rural.
That this is not a normal protein of your body. And then it chops up that cake and eats it and displays it to the other members of the immune system so that they can also be educated about it. And so that's the typical course for the Pfizer Moderna. With the Johnson & Johnson vaccine, still the same goal, educate our immune system about the spike protein, but it's done a little differently. And so for the Johnson & Johnson vaccine, you're right, it is the part of a common cold virus, and they've taken out the part of the virus that makes it transmissible. So it can't replicate, it can't make you sick with a cold, but they put into it the same genetic material that codes for the spike protein of the coronavirus. And so sort of the difference is that the Pfizer and Moderna, it's like baking a cake from scratch, And Johnson & Johnson is more like baking a cake from a box instead of a recipe. It's already primed to do that, but it's not going to do it in a way that's deleterious to our body.
Dr. Hebert-McGee, I want to ask you, a lot of people have this question on with the vaccinations, how long will this protection last for them with these vaccinations?
That's an excellent question, and right now we don't have the data to be able to, answer that. I think studies have shown that, at least 90 days, but we're hoping that it's going to be considerably longer. In complete transparency, I think it's important to realize that a limitation to how long the vaccine confers immunity is the variants. So if we don't get a handle on the variants, if everyone doesn't get vaccinated readily, we're going to continue to have mutations. And if we continue to have mutations, it weakens the efficacy of vaccines. So I think you have to look at it hand in hand. Sorry, this is modern technology. The lights go off automatically. But I would say that, you have to look at both aspects. And so you can't look at one in a silo and say, will this vaccine work indefinitely? We know that oftentimes, particularly with the influenza vaccine, right? With the flu vaccine, we have to get vaccinated every year because there are different mutations. So, this may be something that we have to have done annually for a period of time until we have, enough individuals in society who have been vaccinated.
And Dr. Vanchery, I did want to ask you one question as well. We can't really necessarily know the long-term effects of a vaccination like this because we haven't been studying it for very long. But are you fearful that there may be some long-term effects from these vaccinations?
I've seen no signals of concern. That is to say, no, I'm not. And also that background history of the development of these vaccines over the past couple of decades tells us that the likelihood of any significant long-term events is zero at this point in time. So yes, we're monitoring for those. Yes, we want to be sure there's not, but at the same time, we're now balancing the risk of illness or an issue related to the vaccine compared to the risk of illness and issues related to COVID infection itself. So now we have really a fair comparison, and we know that especially for our older population, those over age 65, represent 80% of the deaths that have occurred due to COVID-19 so far. And so we're balancing risk and benefit and potential of those two, the virus and the vaccine at this point.
I want to walk it back and talk about the mutations that Dr. Hebert-McGee was talking about, and this is directed to you, Dr. Vanchery. You did a very good explanation earlier talking about a lot of people on Facebook asking, we don't have an HIV vaccine. Mm-hmm. It's been 20, 30 years since HIV has been around, and how were we able to come up with a COVID vaccine so soon, in less than a year? Explain the difference in the mutations and why it is so hard to find a vaccine for HIV.
Yeah. So, different types of viruses mutate and acquire mutations at different rates over time. So if you look back at our measles vaccine, we've used the same measles vaccine now for almost 50 years. And that's because measles doesn't mutate very rapidly. On the other extreme is a virus like HIV that mutates very rapidly, especially in a patient who actually has AIDS. And in that case, the virus initiates mutation at every nucleotide, every DNA segment every day in a patient who has AIDS. And so that's more of a moving target to make a vaccine and makes it very, very difficult to keep up with the virus. The coronavirus are more in the middle, but closer to the measles side. We know that the coronavirus and the SARS-CoV-2 virus has been acquiring mutations at a rate of about 2 mutations a month. So over the past year now, we're looking at 20 to 30 mutations compared to the viruses that were initially initiated the pandemic. And most of those mutations are trivial. They have no impact on the virus or on us. And it's only those few mutations that are advantageous for the virus that are the ones that we're really worried about, and those variants you're hearing about with the vaccines, and Dr. Aber-McGee's point is very important. When you look at the Johnson & Johnson vaccine, we know it does not work very well against the South African variant that's been described and is more transmissible and more pathogenic. And so for that particular variant, J&J vaccine is not a good option. The good news is we're not seeing that variant in the United States at this time.
Yeah, that's definitely good news to hear, especially if it's not as effective against that variant. Dr. Aber-McGee, I want to go back to you. I want to ask you a question. Can someone still get COVID if they have had this vaccine?
So that's an interesting question. So we recognize that there is no panacea. Not one of the vaccines is 100% proof. So whether it's 95% effective in preventing COVID-19 or 72% effective in preventing COVID-19, the reality is that the current vaccines, what they do, they minimize the symptoms, meaning that it keeps you out the hospital and it prevents you from dying. And that's what's most important. So most people who do contract the virus after receiving the vaccine, they're typically asymptomatic. They don't even know that they've contracted it. And some may have some mild symptoms similar to having a cold. But the reality is that it's doing what we want and what we need it to do, which is keeping us out of the hospital and keeping people alive.
Here's a big one for you, Dr. Aber-McGee. A question coming in from a viewer. I want to know, how can we trust Johnson & Johnson products when they recalled most Johnson & Johnson products? And I've heard that over and over again. How can we trust this vaccine, when they've been linked to the whole baby powder fiasco and other recalls?
Well, okay, that's a loaded question. But what I would say is that Johnson & Johnson is a huge company. And so this particular vaccine was produced by Janssen, which is its pharmaceutical company, which is located in Belgium. As Dr. Venturi mentioned earlier, that, in order for a vaccine to come to market, for it to be available, it has to be vetted and proven to be safe. I don't think there's ever been a time where the medical industry has been more transparent. So they have shared every step of the what phase of the clinical trials they're in, how they actually were able to sequence the mRNA. Additionally, I think which is very important is that these clinical trials have the most diverse number of, or diverse, I guess, I would say, pool of individuals who actually participated in the clinical trials. So I think J&J, Janssen, or Johnson & Johnson, however you prefer to call it, they went beyond measures. They had over 45% of participants were from Latin America, over 20% or roughly 20% were African American. And so this is unprecedented when we talk about a vaccine. They wanted to make sure that they had a vaccine that could serve everyone. And so it was a multi-country, multi-institutional, multi-demographic study. And that's why they are so transparent, being able to say that, hey, you know what, we know that it's not as effective as it could be or as we would like it to be when it comes to the South African variant. However, we know that it is 72% effective when we're looking at the variants that are currently in the US. And I appreciate that transparency. And what's more important is that they have shown that there have been no hospitalizations and there have been no deaths with this vaccine. And I think if our government, the CDC, our state officials, everyone has been in support of this vaccine. So I don't think there's anything to worry about. And it's very different from baby powder. And that happened at a different period in time compared to the technology that we have today.
Right. Emergency use authorization, that was a question and from viewers. You mentioned the CDC, the FDA, and things like that. How is that different? We know that all three of these are approved under the emergency use authorization. Isn't that different from a full FDA approval, and how is that?
Who's the question directed towards?
It could be either one. Dr. Aber, you can go first, and then we'll do Dr. Venturi.
Okay, so the EUA, it allows for rapid and widespread dissemination in a quick manner. So there is nothing that's being skipped in the evaluation process. It's just allowing for us to be able to mobilize vaccine much quicker than the standard FDA process. So I think that is the reason why we are using the emergency use authorization. I also want to say that just because you have an EUA, it does not mean that the vaccine is no longer being monitored. Mm-hmm. So actually, it continues to be monitored for years. And that's the same when with other drugs and pharmaceutical products, is that once it comes to market, whether you're going through the routine FDA process or whether you're going through this expedited EUA, it continues to be monitored. So there is no shortcuts. It's just allowed for us to be able to have widespread and rapid dissemination.
Dr. Vanchieri, do you want to take a take on that?
No, I agree with Dr. Hebert-McGee. It is no shortcuts have been taken in the science or the health safety issues that are routinely looked at in the development of vaccines. And I've been involved in vaccine trials for more than a decade, and very comfortable with the processes that we've been using.
All right. Let's take a moment and talk about the Johnson & Johnson vaccine. Within the past few weeks, the highly anticipated third vaccine, Johnson & Johnson, was granted emergency use authorization, quickly making its way to people in the Shreveport-Bossier area this past weekend.
Yeah, it was a busy weekend outside the Brookshire's Grocery Arena in Bossier City. People packed the parking lot, pulling up their sleeves to get that shot, and we were there. We wanted to ask them why.
Why did you want to get vaccinated in general?
Just because it cuts down the risk of getting COVID, and I feel like the more we can do to stop it, the better off we are.
I wanted the one dose, opposed to the other vaccines.
I wanted the Johnson & Johnson.
Why is that?
Because I feel like you have to just take it one time instead of taking it 2 times.
Why does that matter?
Because I didn't want to get stuck 2 times.
I recommend it.
Well, it's better to be safe than sorry. Might as well get it. It's being offered, so,
Yeah, we've heard a lot of people say, I don't want to get the shot twice, just that one shot. Dr. Vanchieri, you have been instrumental in setting some of these up in our area. How did the event go? And what did you learn as far as the community's perception of the Johnson & Johnson vaccine?
Yeah. So the event went very well. Of course, it was a beautiful day out there, and we had over 200 volunteers there. We were set up in 6 tents with 12 drive-through lanes, and we have been refining this process over the past 2 months so that we can do large-scale events. And just on Saturday, we administered a little over 500 vaccines in the first hour. And in the second hour, a little more than 500 vaccines again. And then over the rest of the day till 4 p.m., another 900 doses of vaccine. So we had a lot more capacity than we had people coming out to get the vaccine. We know we were approaching near saturation of those who wanted it in our area. And that's part of why we're excited about the governor's expansion of the eligibility criteria today, because we really want to deliver that vaccine fast to stop the variants in their tracks.
And I want to ask you, Dr. Hebert-McGee, you deal a lot with the dealing of as far as allocating those vaccinations, especially in your region down south. How do you determine something like that?
So I think it's important that we try to be judicious and prudent in our allocation. So there's over 2,100 providers who have enrolled within the state in order to be providers for the vaccine. And unfortunately, the demand is outpacing the supply. Mm-hmm. So even now we're waiting to get more J&J in, which has a huge demand, not only in the region, but in the state overall. So when it comes to determining allocation, we look at what is the capacity of the provider. So many providers have a huge vision that they want to vaccinate, the whole city or the whole parish or the whole state, but they don't have the bandwidth to do it. Also, we look at this, the social vulnerability index. So we look to see where are there communities that don't have ready access. So whether they're located in communities of color, if they're located in rural areas, if they're located in areas that have limited transportation access. And we try to look at that vulnerability map and ensure that there is no particular sector of community that's left behind. So, in addition, we look at language barriers, and of course, those who are homebound or have limited mobility, also trying to ensure that they also have access to the vaccine. So it's a concerted effort. We ask our providers to let us know if they have any activities, if they're doing any community vaccination events, mass vaccination events. And we definitely want to ensure that we are getting vaccine to those pivotal pods and locations that are definitely going to have a huge impact. Also, if a provider is able to galvanize, we have churches and community centers that really are fixtures in certain neighborhoods. They're pillars within the community. And so we actually want to make sure that we're also providing vaccine to those locations, not just to our hospitals and FQHCs and pharmacies. So we try to make sure that we have a large macroscopic view of the landscape and that no particular community is left behind.
That's really great, Dr. Aber-McGee, that you guys are doing vaccinations for the homebound in Region 1 down there in South Louisiana. I want to direct this to Dr. John Vancheri. We're in Region number 7, I believe, here in North Louisiana. Are we doing homebound vaccinations, or do we have a plan to?
So at this point, patients who are in care of home health organizations are being vaccinated. And Dr. White and I are working together on developing the plans and getting out vaccine for those who are homebound. One of the nice things about the drive-through vaccination sites that we have set up is that a lot of folks who are, homebound can ride in a car and have come through, and many of them say they haven't been out of their house for a very, very long time. So, and they're not able to, say, walk into a clinic or walk into a pharmacy, and so that kind of meets them in the middle. But we are working on a plan to get really with Council on Aging and other organizations to make sure that anyone who's homebound and eligible for vaccine is taken care of.
And Dr. Vancheri, we just got a question in from Facebook here. It says, if we have had COVID and then get vaccinated, will our immune response be stronger than of someone who did not have COVID? What's your answer to that?
Yeah, so a couple of things that we know and a lot we don't know at this point. So number one is if you've had COVID in the past and then get a vaccine dose, you're more likely to have side effects from the vaccine dose. So don't be surprised. And that makes sense because your immune system already is going to recognize that vaccine and say, oh, I know what to do with this, and start pounding away as if it's a real infection. So more side effects is well known for those who have had COVID infection in the past. We still don't know the answer to the question of if someone has had COVID and then gets a dose of vaccine, do they need a second dose if they've gotten the Pfizer or Moderna vaccine? That's an important question, but we don't know the answer to that yet. Otherwise, what we're seeing in the few cases where individuals have had COVID and then we've given them a dose of vaccine and then we've looked at their antibody levels, we see that their antibody levels boost very, very high, as if they had or to the level that it would be expected if they had 2 doses of vaccine. So we're learning, but we don't have quite enough information yet to make any change in the current policy.
All right, Dr. Vancheri, we do want to remind you that we are in on this discussion right now on Facebook. You can see right there, you guys are giving us some really great answers tonight. We are streaming live our special COVID Cold Feet, the truth about vaccines right now. You can send us these questions that we've been asking to Dr. Vancheri and Aber-McGee. We are monitoring those and we are asking them live tonight over the next 30 minutes for however long we're going to be here. We're getting some really great questions.
Really great questions. This one coming in next about angioedema, Dr. Vancheri, when you were just talking about different side effects, which means that they have severe allergic reactions to a medicine which caused their face, their throat to swell, their tongue. They had to be put into an induced coma. And so the question is, they are wondering, will they be subjected to a similar reaction?
So the angioedema reactions or allergic reactions other than anaphylaxis, well, actually, all of those are very uncommon reactions. So anaphylaxis, based on the data from CDC with respect to the Pfizer and Moderna vaccines, may occur in about 2 to 5 people out of 1 million who get dosed with those vaccines. And with the J&J vaccine, that's much less common. We do see what we call minor reactions. Even today, we had a couple of individuals who just sort of felt like they had a little tingling in their throat after getting the vaccine. Actually, one of them said they had a little metallic taste in their mouth, and it didn't get any worse. We were able to treat those patients with a dose of Benadryl, and within 30 minutes, all of their symptoms had subsided. So those severe reactions are very, very unusual. With the Johnson & Johnson vaccine, no cases of anaphylaxis or those severe reactions have been reported worldwide at this point in time. And so again, we have great confidence in the safety of these vaccines because even if those things do occur, those are treatable side effects and manifestations. And we, as all other providers do, maintain the medications we need on site. And of course, if there is a severe reaction, we would call 911 immediately.
Dr. Vancheri, or Dr. McGee, I do want to kind of bounce that same similar question off of you as well. You know, there are some people who are allergic to eggs, they don't get the flu shot. Who should not be getting these vaccines? Is there any particular reason why certain people should not be getting those?
So they made concerted efforts to try to ensure that these vaccines did not contain ingredients that would make people or that would be sorry, give me 1 second, dealing with my technical issues. I mean, I appreciate, as a segue, I really appreciate modern technology and energy conservation, but I literally have no control over these lights, so that's why I keep bouncing back and forth. So segueing back to your question, they made sure that these vaccines really did not contain ingredients that were going to cause an allergic severe immune response. So there are no eggs, there are no nuts, there are no latex, there isn't a microchip, which is also part of the misconception that is inside of the vaccine. And as Dr. Vancheri mentioned, at our vaccination events, we ensure that we have EpiPens and Benadryl. But if you have had severe anaphylactic responses in the past, we encourage you not to come to these events and actually go and see your primary care physician, who under their guidance, they can actually provide you with the vaccine or tell you which vaccine may be best for you. So that is the current guideline. And I would suggest if someone has had severe anaphylactic reactions to vaccines in the past, that they actually go and confer with their primary care physician about receiving a vaccination.
What about the vaccine? Is it safe for pregnant women or mothers who are breastfeeding, Dr. McGee?
Most definitely. There was this misconception initially that it would affect fertility in women, particularly saying that the spike protein mimics the placental protein, but they're very different. I mean, our immune system is capable of identifying trillions of pathogens and being able to discriminate between the two. Like I tell my patients that there is, even though that's a concern, it will not cause fertility issues because there is not enough overlap in order for your immune system not to be able to distinguish it. So people have told me in the past, I don't know if you agree with this or not, but people have told me in the past that I remind them of Janet Jackson. But what I can tell you is that no one has ever asked me for my autograph, nor has paparazzi stopped and snapped pictures of me. And so the same way that we can distinguish between people, the same way our immune system is able to distinguish between these different proteins. Now, I think it's more important than ever, particularly when we talk about maternal fetal health, particularly when it comes to the crisis in the number of Black women who have died postpartum or peripartum, meaning around their pregnancy. It's important to realize that if you don't take the vaccine and you contract COVID as a pregnant woman, your risk of mortality is significantly higher. So therefore, we are encouraging pregnant women, regardless of race or ethnicity, to get vaccinated in order to protect them as well as the fetus.
Dr. Vancheri, you got a really good chuckle out of the Janet Jackson reference. We didn't know we had a celebrity with us. I want to ask you, should you take any pain relievers like Advil or Tylenol before the shot?
Yeah. No, we recommend that you not do that. And remember that the immune response sometimes includes fever and chills and low-grade fever a day or so. And we really don't want to blunt that. If you do have symptoms, you can take those. That's okay. But we don't want you to take them in advance.
Next question from Facebook. Viewer says, I'm 35 and I have type 2 diabetes and a few other issues. And so I have underlying conditions. When will I be eligible for the vaccine? And we learned today that that is opened up to all adults and teenagers with underlying conditions. So Dr. Vancheri, they can just show up. Is there something that they need to present when they come to these clinics?
So a couple of things. One, remember that there's a specific list of qualifying conditions. It's not just anything. It's just a defined list. And they do not have to demonstrate proof of that or have a note from their doctor or anything like that. We do want folks to pre-register because that allows us to spread folks out during the day and during the week so that we don't have 10,000 cars all at once and don't have long waits. We want to make that as efficient as we can. But pre-registration really is helpful for us to plan our time over the week.
Sticking with the diabetes question, another viewer before we move on says, I am diabetic. Is it okay for me to take this shot? And is it okay for my husband? He's 65 with a heart condition. I think that's the caveat there, heart condition. And she is 60. Is it okay for us?
Yes, the vaccine is recommended for folks in both of those categories and safe for them. One thing we know, especially from the Pfizer data and the Moderna data, is that folks older than age 55 tend to have fewer side effects than younger folks with respect to the Pfizer and Moderna vaccine. So that's a good thing.
Dr. Hebert-McGee, I want to ask you, this is coming in from our Facebook page, will I need to have an annual booster shot after being fully vaccinated?
That has yet to be determined, but it's a strong possibility given the fact that we know that there are variations, we know there are mutations with viruses. In order to ensure that our immune system is able to have a robust response and be able to combat any possible variation or mutation that it may encounter, it may be necessary for us to have booster shots in the future, but we don't have any information on that just yet.
And Doctor, you've been working very closely with the Louisiana Department of Health, seeing the numbers every single day that come in of people being tested and people being vaccinated. Will testing for COVID, do you ever see it stopping as time goes on?
I don't know if it's coming to a complete stop, but I would say that what we recognize is that there are undulations, right? It goes, there are peak times when people want to get tested, and then there are times when people are sort of, relaxed. And I would say that we typically have surges in testing once we have a surge in hospitalizations and deaths. So every time, particularly during the holidays, when we started having a surge in cases, immediately thereafter, we had a number of individuals who reported to all our sites across the state for testing. I think it's important for us to have a pulse on this. So I do think there's a need for testing. Now, will it always be widespread and available, at large centers? Probably not. It probably happen, at pharmacies or at primary care physicians' offices and at hospitals. But I do think that we need to have a pulse on this for a while. And so I don't see testing being completely eliminated anytime in the near future.
This question is for either, Dr. Vancheri or Dr. Hebert-McGee. If you're familiar with this, one of our viewers wrote in saying that after having the BAM infusion in January, they told her that she had to wait 90 days before getting the vaccine, which will be mid-April for her. So the BAM infusion apparently is a COVID IV medication that helps your body fight off the virus in the body. 700 milligrams of fluids, IV fluids, that takes about an hour and a half to run through. So she's wondering if she has to wait those 90 days and if it's going to be safe. That's the BAM infusion.
Yes, the BAM infusion is a monoclonal antibody, so it's like the antibodies that your body makes to fight the virus, but it's giving you the boost. It's kind of like the convalescent plasma that we also used early in the pandemic when we didn't have monoclonal antibodies. And so the answer is yes, you do need to wait those 90 days, because if you have still circulating antibodies from that infusion, it will interfere with the vaccine efficacy. And so that's why we want that 90-day period.
Dr.
Vancherry, do so.
Dr. Vancherry, when could we see herd immunity, and how important is it to get to that level till we can start seeing stores open and going to restaurants without masks and hanging out with our friends again?
Yeah. So the concept of herd immunity is an important one, and it's different. The amount of vaccine that you need to have out is different for different viruses to achieve that herd immunity. So for instance, for measles, it's better than 95% have to be protected. For other infectious diseases, it may be lower. We don't know exactly what our goal has to be, but most folks say it's at least 75% and maybe as high as 90% before we can really achieve herd immunity. We won't really know. It's like, how do you know when we're in a recession? You won't know till you're a ways into that recession, right? So the same is true with herd immunity. We won't know we've gotten there until we get there. And so really that means a big push in vaccination. We're just, getting our vaccine supply beginning to peak up more, which is great. But we've got to really get folks vaccinated as quickly and efficiently as we can to stop the variants from emerging and to get to that level of herd immunity, whatever the number might be.
Do you have a timetable when we could see that happening?
So the way I put it to folks is, at this point, from my perspective, the germ is still winning this battle. And we've got some tools in our toolbox now. We've got 3 vaccines, we've got masks, we've got other things. Our hospital doctors have learned how to save lives better for folks who do have to be in the hospital. So we've got our tools in our toolbox. And the vaccine is now, the virus is now pulling out its tricks. The emergence of those variants are ways that the virus naturally tries to subvert the things that we're doing to prevent it, those vaccinations, and most importantly. And so now we're beginning to get engaged really in a battle. And what we're going to see over the next 4 to 6 months is an increased importance to testing, I think, because as Dr. Aber-McGee says, we've got to keep a pulse on not just how many people are positive, but what is circulating. What are those variants out there looking like? And our lab here does that. The state lab, others around are really intensely looking at those variants to know what's circulating. But really, I think that we may reach herd immunity next fall, fall 21. But that really requires everybody to be committed to getting vaccine. That really requires our vaccine manufacturers to be hitting on all 8 cylinders and getting vaccine supply out to those of us who are delivering it, in the arms of folks in the community. A lot of things still have to go very well for us to turn the tide on this battle.
That is really good news. I want to go back to the one question where you were talking about, Dr. Vancherry, about the efficacy of the vaccine and how you don't want to get the vaccine if you have those antibodies. What if you're asymptomatic and you don't know that you have COVID and then you pull up to get the vaccine? How do we know?
Yeah. So that's always a tricky question. But in the clinical trials, the Pfizer, Moderna, and Johnson & Johnson, to be in those studies, you had to have no prior history of COVID infection based on clinical symptoms. You've never been diagnosed with COVID. However, some folks, when they got there on day 1, had an asymptomatic infection. And so what each of those studies revealed was that those who had asymptomatic infection, the vaccine was efficacious and safe in those populations. And so that gives us more information. So that's part of the reason we don't have to test people with an antibody, a blood test, before they get the vaccine, because we know that it's okay to get vaccinated if you've had prior COVID.
Dr. Aber-McGee, I have a question for you. We came in from a viewer just a few minutes ago. It says, can I finally see my grandchildren after getting fully vaccinated?
Yes, yes, and yes.
All right. Lots of grandparents happy to hear that.
Yes. So we want to make sure that, they can, I mean, you can see your grandkids before then, as long as you're masking and social distancing and staying outdoors. But if you want to have those hugs and those kisses and be able to snuggle, it's important that, you wait the 14 days so you don't have to worry about having a mask on. And kids typically have a robust immune system. So if they don't have any pre-existing conditions that have been listed as part of the CDC guidelines, you can feel more than, welcome to go and, do all those things that grandparents love to do with grandkids.
And I'll just reflect on that, for our nursing homes now, as they are getting fully vaccinated, we're seeing that the rates of positive tests in the nursing homes are plummeting, dropping, to very, very low levels. And so we really want to make sure that we can help CMS and the state revise the guidelines on visitation in nursing homes. One of my employees told me she hadn't seen her father in over 11 months, and she went to see him on Sunday in the nursing home where he's been, and he was excited to see her for about 5 minutes, and then he was ready to go to lunch.
Hey, a man's got to eat, right?
My point is that, as we get more and more vaccinated, we will be able to get back to those normal things, the living, loving life we love in Louisiana. So,
Dr. Vancieri.
If I can speak to what Dr. Vancieri just said, sorry to interrupt, but I think it's such a great point, is that the more that we have, we return to normalcy, I think it will not only improve our physical health, but also our mental health. I think that, as humans, we are not meant to live in silos. We always say no man is an island, but I think that many people have been affected by isolation, by the loss of connectivity. We don't recognize how many people live independently. And so, going into work or going to church or doing those type of activities allows for them to be able to communicate with people if they don't have family members. And for those who do have family members, but they don't live in the same household, I think it's definitely been a strain. And I think as we have more individuals who get vaccinated, I think not only will it affect and boost our economy, but also our economic, emotional, growth and health. So I think it's important that we consider, all the ramifications that this pandemic has caused, and just making these, minor steps. If everyone just, does their concerted effort, continuing to social distance, continuing to, try to get access to the vaccine when they are eligible, I think, we'll be in a much better place mentally as well as physically.
Yeah, I've seen my child, my kids even make a huge change whenever this all happened, and just how difficult it was for them to be isolated from their friends at school. And it was just really, really hard, not just on adults, but kids as well. Yeah. And Dr. Vancieri, I do want to stick with the point with the kids as well, because I understand that there is a study that you guys are undergoing right now with children. And when will children be able to take the vaccine?
Yeah. So the pediatric studies right now are in phase 1, which is the really determining what is the right dose for children by age group. And that's always the first step, because children are different than adults. They can't just half the dose because they're half the size or those kind of things. And for some medications in particular, kids need bigger doses than adults. So the first step is that phase 1, determine what's the right dose. That's ongoing. And the phase 2 and 3, when we look at the safety and effectiveness, are slated to begin in May, and with enrollment beginning in late May and into the summer for those in the 5 to 11-year-old age group. We've already enrolled down to age 12, and those kids 12 to 15 years of age are in their follow-up period. But it takes longer to know the effectiveness of the vaccine because they have milder symptoms and they have their, you can't look for hospitalization as an endpoint because 1 in a million children is severely affected by this virus. It's very different than in the older adult population.
Why
So
is
there are
that?
a lot of moving parts, but we're looking at those studies, and enrollment of the birth to 5-year-old cohort should start late summer, maybe around maybe before Labor Day, and it's likely that we will not have pediatric vaccines down into the younger than age 12 for about another year.
Why is that they have, more of an asymptomatic response? Is it because of the underlying issues that many of the adults have seen, that we've seen, that have passed away? But then again, we know some adults that have not had any underlying health issues.
Right. This is one of those things that scares me as a father, a pediatrician, and an infectious disease doctor, is that, we can't predict who will do well or not. I've seen patients who are 104 years old get COVID and do just fine, like it's just a cold. But I've also taken care of children with very severe complications who are 4 and 5 years old with no underlying condition. So there's a lot we don't know about why one person and not others, or why these 10 and not these 100. But one of the hypotheses is that because other coronaviruses circulate in the pediatric population in children more frequently, that those may give some added protection against the SARS coronavirus. But there's also recent data, and really important to know, that we really haven't studied transmission very aggressively in children of the SARS coronavirus. And we still have a lot of questions about whether kids can be transmitting more than we actually know at this point in time. So there are a lot of unknown questions there.
Yeah, that is very interesting, because if you really do think about it, all those kids, they bring home all that crud from school all the time. They've built up that immune system with all of those little viruses that go around. Dr. Hebert-McGee, I want to ask you a question and see how you can answer this one. It's coming from our Facebook. How effective are the COVID-19 vaccines to transplant patients?
So that's an interesting question. We realize that individuals who are immunocompromised, who are taking certain drugs, it may minimize their a robust immune response. So therefore, they may have it may take longer for them to actually create antibodies, given the fact that they are immunocompromised, which is one of the reasons that we try not to vaccinate people who are actively fighting cancer, because we know that if they're receiving chemo and radiation and they're taking steroidal treatment, that they may not be able to mount an immune response. The interesting thing, and then of course Dr. Vancheri can comment on this as well. I think having received 2 vaccines, that it may actually be more beneficial for those who are immunocompromised, because if they get the first dose and then it gives their immune system some time, and then they have the second dose, it may actually help them have a more robust immune response. But I'm not an immunologist, so that is just my general clinician hat speaking. But I think that we are encouraging those individuals to get the vaccine, because we recognize if they do contract the COVID virus, they may not have the capacity to be able to fight as someone who does not have a compromised immune system.
Dr. Hebert-McGee, go ahead, Dr. Vancheri, if you want to add to that.
Yeah, I agree with Dr. Hebert-McGee, and I'll just add that it may be, for instance, that for immune compromised patients, that they do need to have a booster even every 6 months or something, just to maintain protection. Those are questions that we don't know the answers to yet, and we and others are beginning to study those so that we can make good scientific judgment about where to go.
Dr. Hebert-McGee, I believe you touched on this question, and this is coming in from Facebook as well. After being vaccinated, should we still quarantine when traveling before coming in contact with loved ones? I can relate to this as well. I haven't seen my parents in over a year.
It's
They're
been
in
a
Florida.
struggle.
It has been a struggle. Yes, they have just been vaccinated with their first dose of Moderna last week, so we're getting there. My family, we have not been vaccinated. We don't fall in that age range yet or underlying conditions. But if they were to fly here, do they have to quarantine before I give them that big hug?
You know, there's a lot of conversation around this, and some, you know, it's about if they're doing international travel, if they're doing domestic travel. But the reality is that these variants, they're spreading relatively quickly. I mean, you know, September 2020 is when we first heard about this UK variant, and by January, it was here in the US, and they believe by the end of March, it's going to be the dominant variant, you know, for over 50% of the cases within the state. We also have the California variant. There are 13 cases of that. There's New York variant, which is not here yet in Louisiana, but it is present in multiple other states. So my point is that when you travel, there is a propensity that you may, you know, be exposed to other individuals. So I would say that you should try to use precautions that are going to mitigate. I wouldn't say, you know, 14 days, but I would say that, you know, if you're visiting family members who have yet to be vaccinated or who have not completed their vaccination series and who have pre-existing conditions that would, you know, cause severe disease if they were to get COVID-19. I think you have to be smart. You know, just because you've been vaccinated, it doesn't mean that you have a free pass and, you know, you can do what you want. I think you have to realize that you can still transmit, you know, even though you're asymptomatic. So I would say be smart in your approach, and I think that you'll be fine if you just use common sense.
Dr. Vancherry, really quick, we only have about 30 seconds before we have to go. It's been a really quick hour, but your final thoughts on how, if someone is still on the fence on getting a vaccine, what do you say to them?
Well, taking off from Dr. Hebert-McGee, you know, the risk will never be zero.
Yeah.
We can definitely say that. And so mitigation strategies are critically important. And the vaccine and the masks are our best strategies for turning the tide on this pandemic. But it takes everybody to do it. The vaccines are very safe. They're very, very effective. On the effectiveness, these are home runs. And on the safety side, very, very safe. And so I encourage people very strongly, get vaccinated when you're eligible to protect yourselves and your loved ones.
Well, we thank you guys so much for being here. We are running out of time. We appreciate all of your amazing insight. And you can find this information. We're posting this right now to our KSLA News 12 Facebook page and KSLA.com, our KSLA News 12 app, so you can get more on our COVID cold feet. Have a good night.
Have a good night, and thank you for joining us.
Thank you.
Thank you.
Stay first aware on the latest news and weather from KSLA News 12 for free on Roku, Amazon Fire, and Apple TV apps. Sponsored by Gordon McKernan Injury Attorneys, where we live, where you live. Get Gordon. Get it done.